Back, folks. It is flu season indeed, and it is, well, pretty rampant this year, I would say. Dr. Manisha Juthani joins us from Yale University, and so you can tell us a little bit about how to stay healthy during flu season. A couple things to think about. First of all, let's talk about symptoms, because sometimes people don't know whether they've got the flu or maybe just a tough cold. What are some of the differences?
Well, some of the things to think about, it's common, first of all, to have fever, sore throat, cough, but those are very generic symptoms, and sometimes it's very difficult to differentiate one virus from another. There's a syndrome called influenza-like illness, and there are a lot of respiratory viruses that can do that. When you have a higher fever, when you have body aches, that might be more suggestive of the flu. But if you have any of those symptoms, it could be any one of the viruses. So the best way to protect yourself right now is still to get the flu shot.
I was just going to ask that too, because some people are thinking, well, some don't like the idea of getting a flu shot, but for those who are thinking, gosh, I would have liked to, I should have, could have, would have, it's not too late? It's
absolutely not too late. It does take about 2 weeks for your body to build immunity, but you still have plenty of time to develop an immunity. Cases are still on the rise in Connecticut. Within Connecticut itself, we've had over 1,000 documented cases of influenza. Over 200 people have been hospitalized for influenza. So at this point, getting your vaccine is still your best bet. One point I'd like to make is that a lot of times people tell me, well, I got the flu shot and I still got the flu. The reality is that so many of these symptoms overlap with other viruses. We have about 8 different viruses that we check for at Yale New Haven when somebody comes in with an influenza-like illness, and many times it's another virus. We can't do anything about those, but your flu shot is your best way to still protect you from getting the flu, which often ends up being the worst.
And it's interesting too, because you were just a few moments ago talking about different symptoms, and it can be pretty hard for the average person to know, okay, well, how severe is this, and therefore what is it? How tough is it for the medical community to diagnose and figure out what a person has?
Absolutely. It's just as difficult for physicians to say for sure whether somebody has influenza without diagnostic testing. So a lot of times, if you get caught early within the first 48 hours, your doctor may be able to prescribe a medication to help reduce the duration of symptoms. But a lot of times, it's just that we need to do our own diagnostic testing, a nasal swab, to be able to differentiate what type of virus it is that's causing the symptoms that you have. And so going to your doctor, calling up, finding out whether an appointment is necessary is probably the best way to go. A couple of other things to keep in mind, though, is that now that we know that flu is all over the place, throughout Connecticut, Fairfield County being the most, New Haven being second, a lot of times there are things you can do even if you know in your work environment or in your home that
That's why I brought this
people
over.
have the flu.
It's kind of empty, but you know, sanitizing.
Absolutely.
Oh, and also, how about some fresh fruit?
Sure.
That's fake, I think, so let's not bite into that, but some things we can do.
Absolutely, certain things you can do. So certainly hand hygiene is always your best bet in terms of reducing the amount that you actually get a virus on your hands and you touch your face and you may inoculate yourself that way.
Yeah.
But another thing is that people around you may be coughing, sneezing. When it's really dry the way it is right now in the wintertime, the droplets just kind of hang out for long periods of time in the air. So people sneeze, they cough, and they hang out, and then you're close enough to somebody where then you inhale it, and that's the most common way for people to get the flu and for it to be transmitted.
So we have to finish up, but it's probably a good idea then to, if you need to, cough into your sleeve or into your hands and then sanitize, whatever.
Exactly.
Wash and sanitize lots. All right, thank you, Dr. Juthani. So appreciate you coming in.
Thank you.